Wikidonis.com. Truth about tooth.
Hi viewers, I am Dr. Thomas Nechupadam from Nechupadam Dental. I told you last time that I will be speaking about implants and implant supported bridges, because last time we spoke about implant retained dentures, and then what else is there? Implant retained dentures is basically to retain only, but implant bridges are the real ones, which is actually just like your natural tooth. Why I tell you just like your natural tooth? Because you know that dentures can be removed and you can wash it and keep it back. But in the normal case, a bridge on the implants with multiple implants and the bridge doesn't have to be removed. It will just look like your natural teeth. It will have the proper emergence profile. What is an emergence profile? It looks as though it comes out of your gums. So all these things are the benefits of having an implant bridge. What is the difficulty in implant bridge? You need to have enough bone, or we'll have to go for a thinner implant. These are the two ways. Either you have enough bone, or we have to make bone, or we have to do bone grafting and do, the width of the bone has to be increased by using bone grafting, bone expanding procedures, bone regenerating procedures and things like that, and then we'll have to make bone, and then we'll have to put a larger implant. Or we can go for something called as the new implants, which is evolving and which was already there, but there are bicortical implants which are even thinner, and it will actually work like proper implant, which is actually longer in those things, and it anchors from a proper bone or a heavy bone which is there inside, or your heavy bone which is like your cortical bone is what we call it. So it is like a thicker bone. So it is just like a nail which goes into concrete, it just holds on there. So that are the different options. If you have a thinner bone, we'll have to either increase the bone using bone expansion procedures, bone grafting procedures, and then do a wider implant, or we can do something called as a cortical bone implant. So these are the implants that will help you to have a natural looking teeth, which are actually doesn't have to be removed at all. We can actually do in two ways. Either you can cement the bridge onto the implant, or you can do using a screw retained crown. Or I have been talking about screw retained crowns when I talked about the crowns. If you have not watched the crowns video, please watch it, and you will understand about how a screw retained crown looks. Or we can use a cemented crown wherein it is actually cemented to the implant. So what is the difference between a screw retained? Because screw retained can be removed and cleaned under the thing, but that has a problem that the screws can become loose and then it can become a little wobbly later. But the cement retained has the advantage that it doesn't become loose that easily, but the bad thing is that it cannot be removed very easily, or it has to be cut and removed, and then we'll have to replace it with a newer crown. So these are the pros and cons in the implant bridges also. So it is always good to keep your natural teeth. If at all you have lost all the teeth, then the only good thing that can happen to you is actually having an implant bridge. What are the different types of implant bridge? As I was telling you, understood that there are endosseous implant, whereas the implant is actually submerged to your alveolar bone. The alveolar bone is the bone which is actually supporting your natural teeth, and it goes off if your natural teeth goes off. So it becomes thinner and thinner every day since the tooth has been removed. So actually it is much better to have your implants done as early as possible rather than waiting for quite long. Or we'll have to do something called as like if it was lost by periodontal issues and things like that, you already would have lost the bone. Then we'll have to do a lot of bone grafting procedures so that we will have enough width of the bone and the height of the bone, so that we can have that proper size of the implant, which will actually support your bridge on. And now there are a lot of cortical stabilized implants, or the implant stability doesn't come from the bone on the alveolar side. Actually it takes the stability from the cortical bone, or it is like just like I was telling, like you put a screw onto a concrete or a iron nail onto the concrete, it just grips onto the cortical bone itself. So it may be a thinner implant, and it could be in multiple implants. Rather, we don't do like 6 implants to do a full mouth, or 8 implants to do a full mouth. We actually do, when we do a lot of this cortical anchored implants, we actually, or they call it as basal implants, because it is actually anchoring into the basal bone. They call it as basal implants and things like that. Then what happens is there is multiple implants, so which are even thinner in size, so we can do it in most of the bone. So, and then we do a cemented bridge on top of that implant, so that it just stays just like your natural teeth. So what I want to say in general is that whether you have lost the tooth, you don't have to worry. You can actually increase your vertical dimension. You can actually make yourself look younger and lose all your crevices, which is actually formed when you lose the teeth. And we can actually make you look much better, much younger, much stronger teeth if you have lost it. But mind you, I will always encourage you to have all your natural teeth. Don't go to the dentist and tell that, oh, I want implants, so please remove all my teeth. I want to look good. Please don't do that. Rather, you can go for a crown or things like that. Implants are not proper replacement of teeth, because it is all artificial. So I don't want you to have an artificial teeth. I want you to have proper natural teeth, which looks much, much better. But if you have already lost it, or if you have lost it to your periodontal issues, there are people who have lost it through cancer. There are people who have lost it to other diseases, which like osteoporosis and things like that. We have options that can actually correct all those things. Mind you, two other things which I'd like to tell you. If you are doing an implant, please make sure that you do a proper follow-up, because you lost your teeth because you didn't follow up. So we don't want you to lose the teeth. Implant also later, because implants are not just a screw on your bone, but it is also a living area around the implant. So basically you have to keep it clean. You have to keep do a proper follow-up, so that the implant is live and the implant is actually taken up by the bone, and you can use it for quite some time. I have seen implants stay for 30 years. I have seen bridges stay for 30 years. Implant supported bridges also will stay as long as it could be, but it needs a proper follow-up and it needs proper care. The best thing, if at all you have done implants and if you think, oh, I have not done that, please make sure that you ask your dentist to have a proper care done, or a package for the care for years, whatever you are given the warranty or things like that. Or you can do something like an AMC to do proper care and follow-up treatments and things like that with your dentist. The best thing that happened to the implant dentistry is actually something called as Waterpik. The Waterpik is actually a tool which can spray a lot of pressurized water onto the implant, so that it can be cleaned properly. So if you have not known about it, please look into Waterpik or any other oral water flossers which is available on the net. Please make sure that you use one of them, so that you can wash under the crowns and things like that. If you're watching me after having an implant, please make sure that you do that, or you ask your dentist what else can be useful for you. So all the best. Don't lose your heart by losing your teeth. You can still have natural looking, just feel like natural looking tooth, and you can actually have excellent biting, and the face comes back to a younger look if you have already lost your teeth. So you don't have to worry. Implant supported bridge is a very good treatment plan, but I always tell you, natural is always the best. But we also have replacements if you have lost your natural. Thank you very much. I am Dr. Thomas Nechipadan from Nechipadan Dental. If you have not subscribed my channel, please subscribe it. Please press the bell near the subscribe button, so that you will get notifications of my video. Please send it to all your friends who have already lost the teeth or having a problem with the denture, especially to your older friends. please send it across so that they'll also have a proper implant supported bridge. If you are watching from abroad, please make sure that you go to your dentist and have a look on your this thing. If it is expensive, please feel free. We are in India, we can actually do a implant supported bridge that doesn't have to be removed at all at a cheaper price. So you are welcome. If you are actually sitting in international countries and watching me, please make sure that you send me a comment and I'll speak to you, and then we can think about doing it in India. Thank you very much. Welcome to India. Welcome to Kerala. Welcome to Kochi. If you are at all, you are in Kochi, we are happy to welcome you for a coffee with me. Thank you very much.
Wikidonus.com